Okay, guys, so super excited to get started. This is our back pain or back and sciatica pain kind of workshop. So wanted to give you a little bit about who we are. I'll introduce myself. Most of you guys know me. And then we'll also introduce you to Ben. So I'm Stephanie Crowley. I have been a physical therapist for almost 20 years. And backs, man, I love treating backs because it's probably the one thing that so many people get wrong. And we're going to go into a lot of the things that is the reason why people get it wrong. But I mean, I've been in and out of back pain myself. I mean, it's like literally like one of the most common things that people get. And I know when I start having some issues, especially as I've gotten older, you know, the first thing that comes into my brain is like, oh my God, am I going to be able to fix this myself? And then you start just going down these paths of like, oh my gosh, this is really serious. Am I going to need to have surgery? You know, maybe I have cancer. I mean, it's amazing what our brains actually really do. And, but ultimately I always figure myself out and get myself back and I get back to living life and doing all the things that I love to do. And so that's really ultimately what we love to do for our patients as well, because I know, you know, if I have these same feelings, then I know it's got to be like 10 times worse for my patients because I do this for a living and I know what to do. And our bodies have this amazing ability to heal if we give it the right environment and understand it and kind of change some of the things that we do within our lifestyle sometimes that create some of these problems. And that's a little bit about like why I love doing this and kind of some of the things that we'll talk about today. So Ben, why don't you give your intro?
My name is Ben Carroll. I've been a physical therapist for about 5 years. I've been working with Stephanie since last fall. I really came over here to join up with her because I was working at a similar setting, but I just wasn't able to spend the time with my patients that I wanted to. And yeah, like she was saying, you know, we deal with a lot of low back pain here, and I think it's a really fun thing to work with because low back pain can be really debilitating. So you see these big changes in people's lives, and you can make a huge difference for people as far as just getting them back to the things they want to be able to do.
So let's go into kind of the first thing. So some of the things that we're going to be talking about today are why pain pills, medications, injections, and surgeries don't always work. We'll get into why MRIs and imaging leads us down to more unnecessary treatments and procedures, and what healthcare providers miss in helping you get back to living your life and staying active and mobile. So these are really the three main topics that we'll get into and kind of help you understand. So some of the things that on how we can kind of help you is I always like to say where the side of the pain is often not where the source of the pain is located. This happens all the time. I've had patients with back pain that literally have pain like in their hip, but they don't really have pain in their back. And they think, well, no, it's not my back. Back's not an issue. It's my hip. My hip is what hurts. Or my leg is what hurts. And in reality, we always screen the back for all conditions. Like if you have hip issues, knee issues, we always screen the back because so often the back is where the source of where the problem is coming from. And we've got to address that first. So that's where a lot of people miss things is because they go to the side of the pain and say, nope, that's where it is. And really with our evaluation process, we really get down to the source of what it is and figuring out what we need to do. And then at the end, kind of stay tuned because we'll give you kind of a special offer on talking to one of the specialists for free so we can kind of help you make a better decision about like what your next steps are for your health. So some of the causes of back pain, you know, we always look at decreased mobility in the hips, back, and even thoracic spine. So I always love to go above and below to really see what's going on there. Because even if we just go like, okay, it's just your back that we're looking at, we often find that there's issues in the hip as well that need to be addressed. And if we don't address some of those things, then then things tend to kind of come back. And we don't want that. We want to really teach you what you can do to keep some of this stuff away. And our body's really connected. So if we really don't look at the whole big picture, then we're really not doing you justice as a patient. Other things that we look at are muscle imbalances and movement habits. So once we understand like what your mobility looks like and we've fixed that piece of it, then we're looking into movement patterns and things like that on like, what are you doing that might be creating some of these problems? So that's another piece that we look at. And obviously muscle tightness, hips, IT band, hamstrings, quads, those kind of things. Getting down to the source of why some of these things are tight. Some of these things could be happening for a really long time. Like we had a patient that was in here that came in here actually today, and we his back was like, just spasmed up, and we got all that fixed and everything's feeling really good. But he has some of these residual issues and that we're having to address, and they're more into that hip, and they're more things that are tightness and that we have to address. And we were just having this conversation about like, yeah, this probably what you're having here in this hip probably is something that's been going on for a really long time. And the patient was saying like, yeah, like I feel like I've had this for probably a year. And that's really what probably spurred him having some of the issues that he was having in his back, was because of things that were going on in that hip that we're now able to address and improve and those kind of things. So we really look at the whole big picture. And really the last piece is your postural habits. Like that is so big with the back. Like we have got to fix some of the postural habits that we're constantly in, whether it's I have a sitting job, or I'm going out doing gardening and I'm always bent over, or I'm always cycling. I'm like, what are the postures throughout the day that could be creating and giving you some problems, and coming around a game plan as far as like what we need to do on keeping you healthy so that these things don't come back. So Ben, why don't you talk a little bit about medications and injections and why they don't always work?
So kind of just to explain the slide a little bit there, it shows those 3 different types of pain. So, mechanical would be more of that, bending your finger back, and, you feel that if you hold it there too long, or if you push it too far. Thermal is more of like, you put your hand on the stove or something like that, you touch a hot plate. Chemical pain is more the inflammation type of pain. It'll hang around there. Nothing can really take it away. So, and they all kind of respond to different things. So, let's not worry about thermal pain, because we're not treating burns. So with the chemical pain, really what we see is that chemicals will help with chemicals. So that is probably the one time where, taking those anti-inflammatory drugs and taking steroids and things like that will actually give you some help. But really that chemical phase is usually just that first initial injury phase. So that's why a lot of those drugs won't work in the long term. And because if you're feeling mechanical pain, really the only thing that can change that is changing the position, doing the right kind of movements to unlock that joint or stretch out the right muscle. And the drug just won't help. And injections are the same kind of idea. They're just injecting a chemical in there. It's not going to change the mechanical structure. So we have to look at that differently than, trying to just treat it with drugs.
Yeah, some of the questions that I love to ask, and I love to give patients to ask, because there's some great questions you can ask to determine, is this mechanical pain or is this chemical pain? And one of the questions that I like to ask, or at least equip my patients to understand, is if you can change your body position and make your pain better or worse, that's mechanical pain, because you're moving your body. Those are the mechanics. So if you can change the way you're positioning your body and you can make it better or worse, that's not chemical. So if you already know that answer to that question, you're like, yes, I can move my body and make different changes in my pain, then you pretty much can say like, okay, well, the drugs probably aren't going to help you. Maybe it'll take the edge off, but we've got to get to the mechanics of what's going on. My other question is your pain, is your pain there all the time, or does it come and go? Because if your pain comes and goes, again, chemical pain is that throbby, achy, it always happens, it's always there. That's the chemicals. Like if you're really inflamed on something, you're going to have that kind of achy throbbiness. But if your pain comes and goes, that's mechanics. That's not chemical pain. And that's where we have to go and address the mechanics. We really are the mechanical, like we're the mechanic for the body, and we understand it. And if you can get to a place or a person like similar to this place where that really truly does understand the body and doesn't just go into like where the side of the pain is, and that's the only box that we're going to look at, then you're going to notice bigger changes that can really help get you back to what you really love to do. So why don't you talk, Ben, go into like why surgeries lead to more surgeries?
Yeah, I think the big thing that we see with, especially with the low back. So, usually these people will start off with, okay, I went through a couple injections that didn't really work, especially if you've had pain for a long time, because again, we're not dealing with a chemical issue. And then the next step with that will usually be, okay, let's go in and do a discectomy or a microdiscectomy where we're going to go clean up the disc. Well, they don't really ever get down to what the issue that you were having was. So like, we were mentioned earlier, like those movement habits or posture habits, if we're not changing those, we're putting ourselves at risk again of developing the same issue. So usually, you go through that microdiscectomy and then we end up having a laminectomy or possibly going right to the fusion. And I mean, really with the fusion, I mean, that's the end of the line for that part of your spine because it's locked down after that. And usually what happens is, it's going to affect the level above and below. So those areas start trying to make up for that lack of movement at that fused segment. So you really just get caught in this cycle of one surgery, is leading to another one down the line.
Yeah, I always like to use the finger analogy where if you have your finger and you pull it back and you hold your finger there day after day, year after year, literally that joint doesn't like being in that position. And so if you go in and you can do all the massage and you can do the injections and you can do the surgery, but you go right back to pulling that finger back, essentially you haven't fixed anything. And that's essentially kind of what happens with these surgeries is that they basically go, okay, I fixed it. I took the piece out that was hurting and now you're good. Like go back, like just keep on walking. You're going to be good. And then they go back to the same activities that created the problem to begin with. And no one ever gave them awareness around that. And then all of a sudden they start hurting again. And then you just get into this bad cycle. We literally, like I had a patient a couple of years ago and he went to the surgeon and was having back issues and the doctor asked, had you had physical therapy? He goes, yeah, I had back pain, like 6 years ago. I had PT then and it's back again. Is okay. So check, you've already had PT. So I think we should probably just go in and have surgery. And he's like, okay, because you listened to the doctors. So he went and he was in the waiting room waiting to have surgery with all these other people. And he literally asked these other people, oh, like, what are you in here on back surgery? Okay. How many have you had? And every single person in there was on their second or third back surgery. He was the only one in his first back surgery. And he was on the table to have the surgery. And the nurses that were getting everything prepped and ready to go said, so what's your pain level? And he said 0. And he goes, what do you mean 0? Your pain level's 0? And like the horror on their face, like started to scare him. He's like, no, I told the doctor I don't have any pain in the morning. It hurts when I do these activities. And literally when the doctor walked in to start prepping and getting the surgery ready, he says, I'm done. I'm not going. And luckily he found us. And within probably 5 or 6 visits, he was back to living his life again without anything. And so that just shows you just don't get the education that you need to get when you go into some of the doctor's offices, because they literally can only spend about 3 or 4 minutes with you. They don't really sit down and let's figure these things out. Let's bring awareness around things that you might be doing. And that's exactly what we do. So let's talk about MRIs. Why don't you start off with that, Ben?
So it's kind of like you were saying. I mean, you go into the doctor and they, are going to spend a few minutes with you. They've looked at your MRI, and there's a possibility they're going to jump to that conclusion of, hey, let's go ahead and do like a fusion or a discectomy or something like that. But really, that MRI doesn't show the full picture of what's going on. I mean, most of the time, if they do a MRI of your lower back, it may not even include your hips or it doesn't include your thoracic spine. But other than that, I mean, it shows everything that's wrong, but that may not be the source of your pain. So it may show arthritis, which is totally normal as we age to develop a certain level of arthritis, or degenerative disc disease, which always sounds, like a death sentence basically. But those things don't always correlate to what you're feeling. And if we can move you around and determine how your body's responding to different movements that we're doing, that's a lot better indicator than just this, expensive selfie.
Yeah, that's kind of what I call MRIs. It's an expensive selfie. So you're lying down, not moving, when typically you hurt when you move, and typically hurt when your feet are on the ground, but yet you're lying down taking this picture of yourself. I always like to equate it to like taking a picture of a telephone that doesn't work. You take a picture of it. So do you know if it has service to it? Do you know if it has a ringtone? Does a ringer not work? Like, you only know those things until you like have to sit around and like move it around to kind of figure out, does it have is it even plugged into the wall? That's a good one for me. That's usually what the problem is. But you can't learn that from a picture. And just because it shows, for me, like, I always tell people, like, when the doctor gives you the title that you have arthritis, they just don't know what's going on, because arthritis and degenerative changes, like what Ben was talking about, are things that just naturally happen as we age. It's kind of like going, oh my gosh, you have wrinkles on your face. That's a problem. Like, that's a serious problem. You are going to die because you have wrinkles on your face. I mean, like, that's what they're telling you, essentially. The wrinkles on our face is the same thing as having arthritis and degenerative changes. And if you take 100 people that have no pain whatsoever and put them in imaging, 60 to 90% of them are going to show something. They're no pain. They're fully functional. So if you have 60 to 90% of people that are pain free, that show something, from herniated disc to arthritis to degenerative changes to facet syndrome, like, I know I'm naming big names, but these are the things that the doctors will tell you. What's going to happen when you hurt? And is that really where the pain's coming from? And is there really something that you can do? Yes. The majority of the time, I would say 90% of the cases of people that have back issues can be resolved when you find a good physical therapist that knows what they're doing. We do 200% more surgeries in this country than any other country. And that's because we have so many surgeons, and that's the first option that they like to give people. So let's talk about a little bit on like what other healthcare providers miss. You want to start off with that?
Yeah, I mean, I think the biggest component is the lifestyle habits or movement habits, and just kind of helping you problem solve what you're doing throughout the day that you can change easily to quit aggravating those symptoms. And then, looking above and below where your symptoms are, and really trying to find where the source of that is coming from. So, I mean, we've had plenty of people where, they're feeling everything in their hips, but I mean, it's really their lower back. And we'll go into, some lower back exercise, and it clears up everything, or, vice versa. It's really about trying to find out where the source is coming from. And then, the last part of that slide there is really, getting the whole package. So if you only do massage, it's probably going to come back because you didn't do anything to change the structure. And then if you only do strengthening, that's not really getting down to the source. That's just making you stronger all around there. So usually there's something else missing in those two things that just needs to happen to actually get resolution.
Yeah, and I would say like a common like cookie cutter things that you always hear that we hear for back issues is, core strengthening. If you do core strengthening, and this is even what doctors will tell you, if you do core strengthening, you're going to be good. Well, not necessarily. You've got to improve the mobility and get down to the source of what's going on. And then you have the strengthening component. So you have to have the strengthening component afterwards. But if you do the strengthening component and without like getting down to the source and getting that mobility first, it's not going to work. And same thing with, some people will say like, oh, your hamstrings are really tight. That's why your back is hurting you. Well, no, not necessarily. It can be a component that needs to be addressed, but we've had even people that have had tight hamstrings, and yeah, maybe their back was an issue, but really was their hip that was creating some of that tightness. So again, you've got to get down to the source of what it is. So just because we've had people with hamstring tightness and didn't understand where it was coming from, didn't even touch their hamstring. We knew exactly what to do. And all of a sudden they're like, oh my God, what did you do? Like, I have more hamstring flexibility. You didn't even do any stretches. And that's what I mean. Like, where the side of the issues are, all these symptoms that are happening, we've got to figure out where is the root cause of all this going on. And if we can do that, then you're no longer chasing symptoms. You're no longer going, okay, I just need a massage, every week because, I get relief for at least a day. Is kind of what we hear. So that's, often that's kind of what happens with healthcare, is that you go, to the chiropractor and they only address one thing. You go to a massage therapist, they only address one thing. You go to PT and they only address strengthening. And not all PT is the same. Like there's so many cookie cutters. Oh my gosh, we had someone in not too long ago. And literally I was like, so did they do bringing the knees into your chest, move your legs side to side, stretch your hamstrings? And she's like, oh my God, how did you know? And I'm like, yeah, because that's what the cookie cutter people do with back issues. And it's not cookie cutter when it comes to the back. I mean, there is a thought out evaluation process to really figure out, because it's not like one size fits all. Like once we do an evaluation, we can figure out how we need to move you to get you back to basically, getting down to the source of what's going on. And that's what our evaluation process does here. So some of the biggest things you can take from this is that most injuries do not require surgery or medications. Like I was telling you before, we do 200% more back surgeries in this country than any other country. Most of the time, no one gets the source of your problem, which is, and as to like, why is this happening? So I'm always like, I laughed because we were talking about this just yesterday. I'm like the why kid. But why? Why is this happening? And I'm always curious, like, okay, so you got this pain, but what are you doing? Why did this happen to begin with? What are things that we need to look at and to changing so that we can give you the tools to give you an understanding of what you need to do to keep this away. MRIs and x-rays don't help in guiding treatment or resolving back pain. They don't help me at all. The only time I send people off for MRIs is literally when I'm like, woo, you have some red flags going on, and we're pretty good at finding them because we are able to spend a time with you. And so I'm like, you need to go off and get this addressed and figure this out. X-rays, the only times I really need an x-ray is like if you've fallen and it was a pretty serious fall, I'm like, I kind of want to make sure that there's no fractures. Or if you've been in a serious car accident with like, you have numbness down your arms, I really want you to have an x-ray just to make sure there's no fractures or anything there before we kind of move you. But other than that, I really don't need it. Seeing a specialist to help you figure out where the source is coming from. And I think that's huge. And I think one of the biggest things that we do such a good job here, and the people that typically come into our office are people that's tried so many different things, from acupuncture, chiropractor, physical therapy, doctors, injections, and nothing really has worked. And we've been able to figure this out and get people back to living life again. And that's really what we specialize, is getting you back to living your life again and giving you the tools to get you back to doing the things that you love to do. I mean, when you have pain, it's pretty exhausting. You have a hard time spending time with your family, doing enjoyable things. We've had people that, they just wanted to go hike with their family and they couldn't even do that because their back was hurting so bad. But then, 6 weeks later, when people come in, all of a sudden they're starting to be able to live again. And that's really, truly rewarding for me. I mean, I know it is for Ben too. And that's why we do what we do, because it's so much fun to really impact people's lives. And really, ultimately, I'd say if there's one thing that we probably do the best of is giving people hope that they can get back to living life again and doing what you love to do. Literally, I had a patient that came back in this week, and I treated their son. And the first thing that she had said, like as we were having conversations and catching up and all those good things that we love to do, she literally said, like, the best thing that you said was that I'm going to get you back. And it like gave us hope that, oh my God, I finally am going to have a solution to my son's pain. And that just like, I mean, it gives me chills now to hear that, because it's amazing when you can really impact people's lives that way. Is there anything else you want to add, Ben?
Yeah, I think it just it really pays to invest in yourself and try to figure out where the source was coming from versus just going right to the surgery and drugs. And going with somebody that will take the time to try to figure it out with you, because once you get caught in that kind of vicious circle of medications and surgeries, I mean, it's tough to get out, especially if you have one surgery, like you're saying, you're predisposed to another one. So just taking that time to try to figure it out is really important.
So just kind of want to thank you for taking the time to come out here and really listen to us. So one of the things that we always love to do and we always love to offer is talking to one of us, me and Ben and Lisa, one of our specialists here, so that we can just sit down and learn a little bit more about what's going on with you and kind of helping you make a better decision about your health. I mean, that's ultimately what we do here, is help you make a better decision. Whether you come here or not, we just want you to make a better decision. We don't want you to go down that that vicious cycle that Ben was talking about. And even if you're not having issues with your back right now, but you know other people that are, we are recording this, and you are absolutely get this out and share this with other people, because that's the worst thing, is just having people go down this path and lose hope that they can't get their life back. And ultimately, we just want a chance to be able to talk to them and really give them hope that there is something that you can really do. So again, just want to thank you. I'm going to stop the recording, and we'll be able to answer any questions.